Good morning. Thank you for joining me for our COVID-19 update this morning. With me on the call today are Director Bruno with Jacksonville Sheriff's Office, Fire Chief Keith Powers, and Emergency Operations Director Steve Woodard, who will be available for questions when we conclude this briefing. This morning, the Florida Department of Health is reporting over 500 positive results, folks with COVID-19, 10 deaths, and over 50 hospitalizations. As I said weeks ago, as we increase the availability of these tests, we fully expect the number of cases to increase. The number of positive cases we're seeing today are the results of testing operations. While these numbers continue to increase, our percentage of positive tests remain below 6%, which is well below the averages of major metropolitan areas around the state of Florida. While that's good news, this is no time for us to rest and think that we're out of this. We've got to keep in order to keep the numbers low, we have to continue to practice social distancing. This is very important. I can't stress enough, if you're in a public place, a grocery store, takeout, walking down the street, walking your dogs, stay 6 feet away from other people whenever you can. If you can, wear a cloth face mask to cover your face. You can make homemade ones. Wash and sanitize your hands frequently. These measures are more than about protecting yourself. It's about doing your part to protect this community and your neighbors and your friends. Many have the potential to be carriers of this virus who can spread it with no symptoms. It is the responsibility of all of us to follow these best practices. I've said it before, I'll say it again. The virus doesn't spread itself. We spread the virus. I can't tell you how many times I've observed just in the last few days, or I saw some people the other day in a grocery store. People were checking out. Someone walked in, knew the person that was checking out, and 4 people were congregating within a space of about 2 feet of each other. It's irresponsible and it's unnecessary. I understand that it's habit. I understand that it's our culture to be close and talk to each other. But at this time, we should not be taking these unnecessary risks. 6 feet apart, remind yourself and practice it every single time you're in public. I want to take a moment and address a violent and tragic situation that took place on the north side yesterday. An innocent 5-year-old girl named Kiaria Addison lost her young life when she was caught in the crossfire after a senseless shootout. Her 4-year-old sister was also hurt, but thankfully she'll survive. The sad reality is that even in the midst of what we're experiencing and going through with this virus, we continue to see violence and tragedy like this unnecessarily in our community. It's just tiresome, folks. Sheriff Williams and our state attorney will be providing more information, update on this afternoon as they pursue the folks that performed this horrible, horrible shooting. And I'm sure they will arrest them and prosecute them. Let me address the beaches. Every day, the beaches and all of my executive orders, frankly, every day we assess and question the orders we've put in place and ask, is this one still relevant? Should we pull it back, or do we need to go further? We evaluate this every day. I know there's been a lot of people reaching out to my office, to the mayors of the beaches, about getting people on the beach to walk, exercise, jog, surf. We've all been talking about this for days, for over a week, regularly. The beaches mayors, myself, law enforcement at the beaches, law enforcement here in Duval County in Jacksonville, our Jacksonville Sheriff's Office. And while if we had the resources to control people getting on the beach and continually moving and practice social distancing, it'd be a reasonable option. But we don't have the resources to police it. We're in a city of 1 million people with a larger metropolitan area. The risk and the likelihood of people hearing the beaches are open and coming in from town and everywhere and even parking blocks off and flooding our beaches is just a risk we're not willing to take. It's an unnecessary risk. The most important thing right now is public safety and stopping the spread of this virus. We cannot unnecessarily have people potentially within 6 feet of each other, wall to wall, spreading this virus. I know it's frustrating. I know you want to get back to your activities, whether it's the beach or any number of other activities that people would like us to be back to normal on. But we have to face the reality of the situation that we're in, and we have to make difficult choices so we get through this with as few hospitalizations and as few deaths as possible. There's already 10 deaths. That's 10 too many. Yesterday, the City Council approved our partnership with ViStar Credit Union to provide low-cost loans with less stringent underwriting requirements and flexible repayment terms to help small businesses affected by COVID-19. I'm grateful for my colleagues on City Council and their support of this effort, and I'm going to sign the bill this morning. It's now law, so small businesses, it's time for us to provide them relief with our partnership with ViStar Credit Union. To learn more about the program and apply, businesses and nonprofits can visit vistarcu.org/coronavirus. Yesterday, during our news conference, I took a moment to address the kids in our community, the germ busters and the superheroes that are staying home from school and staying home from the playgrounds and helping us flatten the curve and stop the spread. Many kids have questions and concerns that I want to make sure are being addressed. That's why starting sometime in the near future, I'm going to begin hosting a weekly Zoom conference call with students from throughout our community. I'll also be including local middle and high school journalism students in our press conferences. My public affairs teams will be coordinating this in the coming days. It's important that our young people have their questions answered and their needs addressed. I mentioned to you that what we do in the next few weeks is crucial to flattening the curve. The trends we're seeing now look reasonable. We've got to make sure we continue to do our part. This week, Easter and Passover coincide. Instead of being frustrated with the current situation, I encourage everyone to find a positive in this. We get to spend this holy time with our families, but we get to do it safely. I'm aware of families that are planning to celebrate the Passover Seder together virtually. I applaud their innovation and resiliency. Many are planning to celebrate Easter the same way on Sunday. This is a holy time for many in our city, and I encourage everyone to worship responsibly, to do so virtually when possible, and to continue to practice social distancing and follow CDC guidelines. Before we go to questions, I want to remind everyone to make that call tonight at 7 p.m. Check in with a friend or a loved one, listen to them, share with them, and let them know you're there for them. With that, we'll take questions. Russell with Action News.
Mayor, I was going to ask about the beaches, but I think you addressed that pretty well. The only question I would have is there any kind of timeline of when those are expected to be back open? And then secondly, as far as the 32207 zip code, we saw that has the most cases in the city. Is it because they have the most tests? Is it because they that you believe there's actually a hotbed there? What is the reasoning behind that?
The first question on the beaches, we literally evaluate these executive orders on a daily basis. I don't foresee beaches reopening this week, given what we know now. My discussions with the hospital executives and physicians as recently as today, while hospitals remain stable, if you will, there are no unusual spikes in COVID-19 admissions. We still, based on models, expect to see more activity in the next couple of weeks. What we're seeing now, it appears that we may maybe have flattened this somewhat, and so we're just going to continue to evaluate on a day-to-day basis. Director Woodard, I'll let you take the question on the zip code 32207 and positive cases.
Yes, good morning. We're monitoring all of the activity, and this is something that changes every day. As you know, we had some clusters early on. We're continuing to monitor and make sure if those are present, we're addressing them quickly. But really, the illness is spread out throughout the city. We're encouraged and optimistic about the numbers, but we're going to continue to monitor that and look at each zip code in each area and each person who is affected.
Elizabeth with Action News.
Hi, good morning, Mayor Curry. I have a few questions in regards to hospital supplies. How is it being handled? Do we have enough? Are we getting more?
I'll let Director Woodard take that in 1 second, but let me just say that, and the reason he's going to take the question is because he runs the Emergency Operations Center, and they're coordinating this and have been coordinating supplies on the necessary medical equipment. There's an issue globally, internationally, and nationally in terms of supplies that hospitals need. And so all the hospitals have asks into our Emergency Operations Center for us to help them secure the protective equipment that they need, and we're doing that. But everybody's chasing it. It's an issue all over the nation and around the world. I don't want any physician, any nurse, any hospital worker exposed to anybody with COVID-19 without having the proper protective equipment. And to that end, we're working collaboratively with them to secure what they need. Director Woodard, I'll let you talk specifics.
As the mayor mentioned, the personal protective equipment is an issue not only nationally but internationally. We were fortunate in Jacksonville that we had a significant quantity available here. We were able to push that out early, particularly to the nursing homes and assisted living facilities and to the hospitals. The process is that a hospital or facility will request that to the Emergency Operations Center. We then forward that request to the state. The state has access to the personal protective equipment, some of which is being sent from the state directly to hospitals, and then other equipment is provided to us, and we distribute that here locally. To date, we have distributed over 400,000 pieces of personal protective equipment, and that includes gloves, N95 masks, surgical gowns, face shields, sanitizers, and all of the other equipment that's been required for the testing. So we assess this on a daily basis. We're working closely with the state. We're working with other organizations. And I'll give you a good example. The Florida Dental Association, who had planned to do an event here in Jacksonville in the next couple of months, postponed that event and donated a significant quantity of personal protective equipment that we were able to get into the community and make a difference.
Jim, WJXT.
You know, Mayor, I'm sitting here in Lot J, and I've been here every day since it's opened, and watching the testing procedure and the number of people that come here. Have you heard anything of any changes that might be taking place, like a rapid testing or anything that's going to be happening in Jacksonville as people are now starting to get results, but I know there's still a lot of concern?
There are some hospitals that are performing their own tests, and some of those are rapid tests. And my understanding is the hospitals, in fact, my understanding, I know the hospitals are collaborating. So if a hospital has a patient that needs to be tested, but they don't have the in-house ability to do a rapid test, another hospital that has it is sharing resources to ensure they can move quickly. Director Woodard, I don't know if you have any other insight on additional testing in the days ahead.
As the tests become available, and that's an issue very similar to the personal protective equipment, we're working with the state to get those here. We know of other organizations that are considering doing testing, but it really is a function of having the test kits, having the personnel, and then having the lab capability to process those tests. So we're working with the community to ensure that testing is something that is available to the public. As you know, Jim, if you're out at Lot J, that's operational today and will continue to be operational. But we are limited by the number of tests at that federal site to 250 a day, and we're looking at all available resources to try to see if we can come up with more tests or additional test sites. But that will remain open and transition likely to a state operation within the next few days.
Lou with First Coast News.
Hey, Mayor, every morning we're reporting the numbers of cases nationwide, the deaths, and we also nationwide get a number of people who have recovered from this. I didn't know if we could get that number here locally in Duval County, people who have recovered. I mean, we mentioned the 10 deaths and the 50 hospitalizations, but it could give people perhaps a sense of relief to know that recovery number for sure. And is it something that y'all are tracking right now?
Director Woodard, or the fire chief, any insight on
Yes,
that data?
I'll try to answer that first. One of the sites that we have seen some recovery numbers is the Johns Hopkins site that has actually worldwide numbers, and you may want to start there, World Health Organization. Locally, I don't think we have that granularity yet for recovered cases.
Mike, Daily Record.
Yes, hi, Mayor. In regard to the loan program, now that it's signed into law, is ViStar prepared with all of its infrastructure to process those loans right now? And I know that we've been hearing some national media reports about some of the local banking institutions kind of being overwhelmed with some of the federal loans. Does ViStar are they prepared with the capability to process the influx that's coming in?
Yeah, based on all the information I have, they are. And should they hit any obstacles, we'll work and do everything we can to help them overcome those obstacles. But right now, they're ready to go. Deploy cash to small business owners. Christopher Hong with the Florida Times Union.
Hey, Mayor, I want to talk about violent crime. This is the second, shooting involving a young child in the last 2 years. And, violent crime and shootings are, kind of remaining at a stubbornly high level. Are you in the sheriff's office contemplating any new courses of action or what's to be done about this?
I mean, look, we're going to continue to invest in the prevention intervention, which is through the Kids Hope Alliance, and always have that organization. And they work with other organizations like the Police Athletic League. And there's a number of others to make sure that we're deploying the right resources to young people so they have access to jobs, summer learning programs, and they don't find themselves making really dumb decisions, which is getting involved with firearms and then criminal activity. And then tragically, over a stupid shootout, over a stupid fight, a child gets caught in the crossfire. So I'd say I'm going to continue to collaborate with our sheriff and our state attorney and other experts on public safety and invest the dollars that need to be invested in prevention and intervention, not just enforcement. I've talked before about how the budget years ahead are going to be radically different because the world changed over COVID-19. And so while we will be reevaluating our priorities, I can tell you what we will not be reevaluating is our investment in young people in prevention and intervention to make sure they have the tools and resources they need to stop another tragedy or what happened yesterday from happening again. I just can't believe it. I mean, we're sitting in a pandemic and I'm getting briefed last night by the sheriff that a child's been shot in the head. And it's unbelievable. So the sheriff, state attorney will be providing an update, I believe at noon today. And we'll be pursuing these criminals and making sure that they're brought to justice. Jim with WJXT.
I guess, Mayor, following up on that a bit, any thought of a curfew since violent crime is not going down?
That's another decision, again, that we think about and discuss as a daily part of the orders that we have in place. I'd mentioned the issue with the curfew before about its enforceability. And again, how are we deploying resources, public safety resources in a way that's most well served for the public, but also not putting undue stress on our police officers and our firefighters when they need to be attentive to things that like violent crime, unfortunately, right now, and this pandemic. The option of a curfew is certainly on the table, and I'm possibly willing to go there. I just need to continue evaluating that with our sheriff and others. Oh, Director Bruno, I'm sorry, could you address that?
Well, absolutely. Thank you, Mr. Mayor. In regards to the curfew, the mayor hit on all the high points and the challenges that are there. And certainly in this situation, I mean, I think even the curfew hours that we've discussed, this was outside of that. The sheriff has talked about it before. There's a very small percentage of individuals that are involved in this, the gun activity and the shootings. And we continue to focus our officers in those areas and on these individuals to deter them. The mayor talked about it. It's unbelievable, and it's just unacceptable that individuals will see this as a way of resolving conflict. That no one in society sees it as that opportunity to resolve conflict, and we need to continue focusing on them and arresting them, and that's what the sheriff's office is working on.
Tim with the Jax Business Journal.
Thanks, Mayor. So when it comes to the ViStar loans, obviously $50 million is a lot of money, but you have a lot of companies looking for that. As that pool is drawn down, is there any possibility of increasing the size of it? And is there any thought to lowering the cap, the $100,000 cap on how much businesses can get?
Well, the first goal, let me say, every option is always on the table. Anything that we have in terms of resources available to help businesses get back on their feet and ensure that employees aren't laid off, and maybe those that have been laid off in the recent week or two can get their employment status back. But the goal now would be deploy this, get the cash moving quickly. And if we need to reevaluate at that time and see if there's additional help that we can provide in an effective way. Look, I'm always open to solutions, and so everything's on the table. This will be the last question, and it'll be Ann with First Coast News.
Mayor, good morning. Last night, a hospital in Detroit said that they had around 700 employees who were infected by COVID-19. And it occurred to me to wonder if you have numbers like that for local hospitals as to how much, what percentage of staff of local hospitals have contracted the virus or are sidelined because of it.
So I talk to, again, the hospital leaders and physicians daily, and then also a formal group call. And they've not shared any information with me, alarming information in terms of high percentages of physicians, nurses, healthcare workers that have been infected and have been sidelined. And I every time we talk, I ask a question about any activity at all that's unusual, that could put healthcare workers at risk, or the community, and I've not heard any of that. Director Woodard or Chief Powers, you have any additional insight there?
Yes, sir. I think it's important to note that we have a lot of healthcare workers who, on a daily basis, are out at Lot J, other testing sites, and working in facilities, and we certainly recognize that and appreciate it. We made accommodations for healthcare workers at Lot J to be tested without symptoms. So we're doing everything we can to keep that part of the healthcare worker community healthy and able to serve the public.
Okay, thank you. I would just say, with Passover starting at sundown on Wednesday, and this being Holy Week, and those of us in the Christian faith celebrating the resurrection on Sunday, it is not only a reminder, it is the reality of the fact that as humanity, people, citizens of Jacksonville, we're all in this together, and we're going to stick through this. We're going to socially distance. We're going to make smart, responsible decisions as citizens, and we're going to get through this together. Regardless of how tough it is, we're going to get through this together. I'd ask people to also join me in praying for Kiari Addison and the family, please, at this terribly tragic and unfortunate time. Thank you.